Okay, I'll start. Yeah, I'm Steffi Wohlhandler, and I am a primary care doctor. I'm an internist in the United States. Sometimes internists provide primary care for adults, but I've also done hospitalist work as well. So I'm a professor at the City University of New York right now. I am also a lecturer in medicine at Harvard, where I was for many years a professor of medicine. We together, David and I were founders of the organization's Physicians for a National Health program that's been around a little more than 30 years. It has about 20,000 physician members in the United States. Sounds like a big number if you're Canadian, but in the United States it's only about 2% of the medical profession. But that group advocates for one thing and one thing only, which is a universal single-payer Medicare for all, we call it in the United States, single-payer Medicare for all system. And we've been doing that work, as I say, for about 30 years. We're also health policy researchers, and we've, in our career, spent about half of our time as health policy researchers. A little bit more now. I don't see patients a lot less now. But the work that we've done, we've developed proposals for the United States to move toward a single-payer Medicare for all system. We've done a lot of work on the research of healthcare finance. For instance, we have done a very large share of the total literature comparing administrative costs in the U.S. system to other systems. Usually, frankly, it's compared to Canada. And recently, we're just completing a paper, again, comparing administrative costs in 2017, health administrative costs in 2017 between the U.S. and Canada. We've also done a fair amount of work on the issue of medical bankruptcy, and which is very, very common in the United States. More than half of all personal bankruptcies in the United States are due, at least in part, to medical illness or medical bills. And we've also been advisors to a number of politicians. We've worked very closely with, I don't know if you know U.S. politics very well. Usually Canadians know a lot more about U.S. politics than Americans know about Canadian politics, but we've worked a fair amount with many politicians, but we were the health policy advisors in 2016 for Bernie Sanders' presidential campaign. And we've also worked very closely with Elizabeth Warren, though we don't have a formal policy advisory role with Elizabeth Warren.
So like Steffi, I'm a primary care internist, an odd duck in Canada, and also spent part of my career doing hospitalist work as a physician, and most of the other things she describes of herself are also true of me. We've